What are CFTR mutations and disease progression in CF? Cystic fibrosis is a genetic condition caused by mutations in the cystic fibrosis transmembrane conductance regulator gene. This gene is responsible for making a protein that helps control the movement of salt and water in and out of cells. When the cystic fibrosis transmembrane conductance regulator protein does not function properly, it leads to the production of thick and sticky mucus in various organs, particularly the lungs and pancreas. There are over 2,500 different mutations identified in the cystic fibrosis transmembrane conductance regulator gene. These mutations are categorized into several classes based on their effects on the protein. Class 1 mutations prevent the production of the protein altogether. Class 2 mutations lead to a misfolded protein that cannot reach the cell surface. The most common mutation, known as F508del, falls into this category and causes the protein to be broken down too early. Class 3 mutations allow the protein to reach the surface but prevent it from opening properly, reducing the flow of ions. Class 4 mutations result in a channel that opens but does not conduct ions effectively. Finally, Class 5 mutations produce less functional protein than needed. The severity of cystic fibrosis symptoms can vary greatly depending on the type of mutation present. Mutations that completely stop protein production or prevent it from reaching the cell surface tend to cause more severe symptoms. In contrast, mutations that only partially impair the protein function may lead to milder symptoms. As the cystic fibrosis transmembrane conductance regulator protein fails to regulate the transport of chloride and bicarbonate, thick mucus builds up in the lungs and other organs. This can lead to chronic lung infections, inflammation, and progressive lung damage. Additionally, it can block the releases of digestive enzymes from the pancreas, resulting in digestive issues and malnutrition. Other organs, such as the liver and reproductive system, can also be affected. Understanding the specific type of mutation in an individual with cystic fibrosis is crucial for developing targeted therapies. These therapies, known as correctors and potentiators, aim to improve the protein's folding, trafficking, or function depending on the mutation type. This personalized approach to treatment can significantly improve health outcomes for many individuals living with cystic fibrosis. In summary, cystic fibrosis is caused by mutations in the cystic fibrosis transmembrane conductance regulator gene, leading to defective ion transport and thick mucus accumulation. The progression of the disease involves chronic lung issues, pancreatic insufficiency, and complications in multiple organs. Advances in understanding these mutations have paved the way for targeted therapies that can help manage the condition more effectively. Always consult healthcare professionals for personalized medical advice and treatment options.